about to listen to the Dr. Daliah Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Daliah Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Daliah.
All right, we are back on the Dr. Daliah Show, 1-877-Doc-Dolly, 1-877-DOC-DALI. So all week long, we've been hearing that Biden might be taking cocaine. I don't think that's going on. But there has been a lot of discussions on performing enhancement drugs, and if Biden or Trump would be utilizing them to have a stellar performance at the debate that's going to be happening. And, it's interesting because Biden has gone off the grid for debate prep. And for a man of his age, and from what we have visualized and heard in his interviews and at his press conferences, many of us are struggling to envision how he would be able to manage a debate. We have seen him, however, perform fairly well with the State of the Union, fairly well during some well-choreographed press releases. But as a doctor, I like to put in my 2 cents when I think something could be harmful. And I am hoping to high heaven that the Biden camp is being a lot more cautious when it comes to things that could possibly stimulate Biden and enhance his performance. Now, I think Trump is calling for a drug screen. And the reason why cocaine has come out, and I mean, I understand it's clickbait. You have cocaine and a headline with the Bidens. Somebody's going to read it. And keep in mind, cocaine was found in the White House in a very non-publicly trafficked area of the White House. Even though many people think it was Hunter Biden, there are other people on cocaine. I wouldn't be surprised if there are other people within the Biden camp on cocaine. So just because cocaine was found in the White House doesn't necessarily mean it's the commander in chief's. So that's why cocaine has been brought up. But another reason why it's been brought up is a lot of performance enhancing drugs are stimulants in nature. Adderall, phentermine, diet pills, caffeine. And so many people are concerned that they are going to be giving Biden stimulants or amphetamine or Adderall or Provigil, which is a medication we use for narcolepsy, which is a addictive, controlled substance stimulant. And, when you have somebody of that age, you need to be careful. And to jack anybody up, whether it's Trump or Biden, any senior citizen or somebody of advanced age with stimulants, you could be messing with their heart. They could be anxious. They could become paranoid. They could have difficulty breathing. And you could induce an arrhythmia. You could induce a heart attack in somebody of that age. Actually, I mean, any age. Kids, as you see, drinking energy drinks can have severe cardiac sequelae. So if they're smart, they're not doing that. Now, some people asked, has he been getting B12 infusions? B12 infusions can help the memory, can help your performance, and can help your energy. But that's if you're severely B12 deficient. For the amount that Biden would need to perform to the degree that he would need to, you can't overdose on B12. Have they been giving him some B12 injections and infusions? Who knows? Now, a lot of people get B12. I wouldn't be surprised if that's part of his medical regimen. I think another thing that can help stimulate his brain is CPAP, getting continuous positive airway pressure. And I think that was added after a recent physical where they wanted to improve his brain function, which is something I've said, even if you don't have sleep apnea, I really wonder if that can improve a lot of our brain function and temper our progress to dementia and Alzheimer's later if we're getting more oxygen to the brain and more air to the brain. So I wouldn't be surprised if he's on CPAP therapy, maybe some oxygen therapy. But my guess is if anything was going to be given to help enhance his performance, it would probably be smaller doses of caffeine. I wouldn't be surprised if a Red Bull or coffee, not that I would recommend it. Again, I don't know his cardiac status. I would not be recommending energy drinks, but I wouldn't be surprised if that's something that they would do. One is it's not really detectable on drug screens. If it's caffeine, and you could say he had coffee, he had, it's not considered taboo. And two, there's multiple different forms he could get caffeine through. Gum. Don't they have like a toothpaste now or something like that? There's lozenges. I wouldn't encourage that because a big, fast bolus of caffeine could induce an arrhythmia and cardiac issue. But, we have a president that is that has stumbled a lot and has fumbled and has forgotten things. I think with tonight's debate, which I'm going to be talking about in a little bit, I think we're going to be a little underwhelmed. I think everybody's expecting the fight of their lives. They are going to really temper Trump. They are going to try to prevent him from shaking him up and rattling up Biden. I think it's going to be very, very controlled, very scripted. And so don't really expect, the big fireworks. I know that this debate is being souped up because of ratings and all that. And I'm going to be later on KXNT doing a live broadcast with a bunch of our local radio hosts to, give commentary on what I saw. But from a medical standpoint, you really got to be careful about performance enhancing. Some people will use beeswax and pollen and honey and all sorts of other things. Listen, your functioning requires years of preparation. So when I see people get sick and they start hitting the vitamin C and the zinc, you're already feeling the effects of the virus. You might be able to temper it by a day or two, but you're not going to stop it cold. And so whatever he's been doing this last week, or maybe throughout his presidency, I think might be enough to have him answer the questions, stick to the script, but no, I do not believe they'd give him cocaine. He could have a heart attack. 1-877 Doc Daliah, don't go away.
Let's see, if something costs less, but people are happier with it, that sounds like something to look into, and that's MediShare. Maybe you've heard switching to MediShare to pay for healthcare can save the typical family $500 a month, and that's huge, but it's also true that people are way more satisfied after making the switch, too. The customer satisfaction rate for MediShare is double that of the typical health insurance plan. Double. MediShare works. It's been around for more than a quarter century, and members have shared more than $3 billion of each other's bills. People love having telehealth and a huge nationwide PPO network. So, yeah, you can save a ton and like it better. Imagine being happy with how you're taking care of your health care. So if you're self-employed or part of the gig economy, or you just want a plan you're happy with, you can call right now and get a price within 2 minutes. A very, very smart use of 2 minutes. Here's the number you need. 855-SHARE-40. That's 855-SHARE-40. 855-SHARE-40.
Hey guys, it's Dr. Daliah. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our Fantasy Football Pocket Guide for Beginners found on Amazon, or follow the links on X and Facebook. That's Fantasy Football Pocket Guides for Beginners. Don't be left out.
In a study, it was found that 33% of 44 herbal supplements had no trace of the advertised herb. Don't let that happen to you. Hi, this is Dr. Mitch. If you want to ensure quality, please go to TotalWellness.com. Supplements made for physicians only now available to you too. TotalWellness.com, helping you to look good, feel good, and enjoy total wellness.
We are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen, and big thanks to Daniel, our producer. So Walgreens is set to close a significant number of stores that have been underperforming. This with news following last month of Walmart going to close down all their health centers, not their pharmacies. Walmart pharmacies will stay open, and I believe their ophthalmology or their optometry clinics, but Walmart is going to be closing their health centers as of Friday. In terms of Walgreens, we're going to start with Walgreens first. And but before we begin, this is one of the signs of us slowly moving towards socialized medicine, which I am dreading. And when you see private industry and private industry giants not able to make healthcare work and make it profitable, it leaves a big vacuum for government to step in. And this is a sad day in medicine, and this is not good for us, not good at all. So we got the news today that Walgreens is going to close a, quote, significant number of underperforming stores across the U.S. due to ongoing challenges with profitability and declining margins. Now, they have 8,700 stores. We don't know how many, but CEO Tim Wentworth told the Wall Street Journal that a, quote, meaningful percent of the underperforming locations would shutter. Now, Walgreens stock has dropped, and the dynamics of these stores and sales have been really facing a lot of challenges, not only since COVID, but since law enforcement and local laws have lightened up on crime and prosecutions. And these stores, these Walgreens stores that have amazing locations, like my local Walgreens, I mean, it is right there on a main intersection. I could pull in from a bunch of different ways, and they have the drive-through, and there's anything I want in terms of sugar and makeup and toilet paper. But unfortunately, these very highly public, easily accessible locations are prone to crime. And people walking in, stealing. We've seen the videos of people just waving to security as they leave with makeup or they leave with something. And a big concern that I have as a physician is if many of the stores that are underperforming in underserved areas, that is going to limit access to the underserved populations. People go to their pharmacy not only for their prescription, but for their vaccines. They ask medical advice of the pharmacist, and these pharmacists will say, don't mix those two drugs. People will come to a pharmacist going to have a cold. What do you recommend? And they say, I'm not your doctor, but there are cold medications there. Keep in mind your prescriptions could, and they give a lot of advice. Some of them also have walk-in clinics and nurse practitioners or physician assistants or physicians that are there to provide certain medical care. They offer, mom needing Tylenol in the middle of the night for her child. These pharmacies have been, rather than, the local drugstore, they have been chains that have pervaded through middle America, rural America, etc. And I know because when I practice in Alabama and Mississippi, and there are luckily these beacons of pharmaceutical management from these pharmacies in these rural areas. And people say, look, I go to the Walgreens or I go to the CVS or I go to. So if Walgreens is not finding it sustainable, that shows we have some deeper issues. One is the crime. Some Walgreens said we're not going to be selling retail stuff. We're not, this will just be about the prescriptions. But another sign is they might not be getting reimbursed. Prescriptions are expensive. To stock Ozempic, you are paying list price. And if you're not getting the full $1,600 or $960 or whatever, you take a hit. If you are in a population where it's mostly Medicaid or Medicare, and having been a physician with my practice with Medicare and Medicaid and them paying on maybe 2 out of every 5 claims, it's not sustainable. So a pharmacy in a more suburbish, wealthier area where people are like, I'll just pay cash, they're getting their money. They're making their bottom line, but not if they are relying on government insurance. And so that's sad. That's frightening. Now we go to Walmart. So Walmart announced end of April that they are going to be closing their health centers. Walmart had these like minute clinics, and their health clinics are not sustainable. They're also going to shut down their telehealth service. Now, these health clinics in Walmart, again, offered a cheaper version of urgent care. The cash price was a lot cheaper than many doctors charge or nurse practitioners charge or urgent cares charge or ERs charge. But the business model wasn't sustainable. Why? Well, if they're not getting reimbursed, if insurance isn't paying them, or if people have high deductibles, well, no. If people are finding that the services offered is not what they need. So somebody comes in going to have abdominal pain. They might be having appendicitis. If you walk into a Walmart health center, they could steer you to an urgent care ER. They could call an ambulance for you. But if you want all that care done, it's not going to happen. What I'm noticing with telemedicine is somehow people have the impression that we can manage, skull fractures and CSF fluid leaks. A guy called me saying I have cerebral spinal fluid dripping out of my nose. I said, go to the ER. They said, no, just give me antibiotics. I have people calling with heart attacks, with arrhythmias, with blood clots, and they're expecting telemedicine to do the trick. And I think a lot of people are learning that, they're spending twice if they go to a less acuity care location and then have to be referred to a higher acuity location, and then now they're paying twice. So I don't know all the ins and outs financially, but again, these Walmarts, and Walmart has shuttered some of their stores as well, is again access for underserved populations. When we start to lack health care for our underserved populations, it is a huge public health issue, and the government is going to need to step in. Once the government steps in, it's going to be very easy for them to pervade all of the U.S. I said early on, with the millions upon millions of dollars spent on Obamacare and on the ads and on the website, they could have put that money to free clinics or clinics where you only pay $5 throughout America and the underserved areas. You could have had old MRIs, older CTs donated. You could have pharmaceutical companies donate medications. Doctors donate 1 day a month, and that'll satisfy some of their CME and their board expenses. There's a way to do it, but they're not going to do it. What's going to happen is just this vacuum is going to be filled, and I really fear it's not going to be the type of care that certain populations need. Look at what's happening with Medicare. I had patients who needed pre-op physicals, and they couldn't get their chest x-ray paid for. And I'm like, but if you need a chest x-ray and your surgeon's ordering it for the surgery, why isn't Medicare paying? Now, maybe there was a certain specific code, but it was pretty well known years ago that no, it wasn't getting covered. So as Medicare was covering less and less, we're starting to see what happens when government takes over healthcare. All right, you have less coverage. I can't tell you how many people are underinsured. They have a health insurance card. They bought Obamacare, but their deductible is too damn high. Or their copays are too high. Or their doctor closed down. I had thousands of patients that had to find another doctor because I couldn't keep the business running. The business model is not sustainable when insurance doesn't pay you and patients don't pay you. You can only do so much. And I was ready to go back and wait tables. So seeing Walmart, who is a giant when it comes to retail, customer service, being able to expand in other aspects, their optometry clinics do very well. Couldn't make it from a healthcare standpoint. So I would, go on their websites, find out, what options you have if you have been utilizing these clinics. But we have few and far between places where people can count and bank on having immediate access. It used to be the urgent cares. I'll go up the street, I'll go into the walk-in clinic, and I'll be good. Now people are telling me the urgent cares are starting to say we're limited. Sorry, we maxed for the day, so we can't take any more. So what happens? People go home and they get sicker and sicker, or they end up going to the ER. We need to improve our walk-in clinics. We need to go back to family medicine, which is what I'm trained in, and get people back with a primary care provider so they don't have to need acute care. 1-877-DOC-DALIAH. Don't go away. Dr. Daliah here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALIAH, 1-877-DOCDALI. Don't forget to follow us on X or Twitter at Dr. Daliah, Facebook, The Dr. Daliah Show, and on YouTube, click like and subscribe. So I know some of you are confused about what happened with SCOTUS this week, Supreme Court, and Idaho's abortion law. Idaho has enacted the Defense of Life Act, making it a crime, essentially, for any medical provider to perform an abortion. However, there are exceptions for rape, incest, and life of the mother. Well, today, SCOTUS had ruled and upheld emergency exemptions to Idaho's quote-unquote abortion ban. Now, this is confusing to some because the Supreme Court is ruling that doctors in Idaho must be allowed to provide emergency abortions. But the law already allows for that. But I'll tell you what the semantics are. This is why law is too much for me and why I didn't go into law. Because when you dissect down and dissect down and dissect down, you go, oh, those are two different statements. The sky is blue. The sky is blue. In law, they can make those two statements completely different. And you're like, they look the same to me. So the Supreme Court said that this near total ban, it's not a complete abortion ban in Idaho. To save the life of the mother, it's granted rape, incest. But the federal law requires emergency rooms give stabilizing treatments to patients in critical condition. And the court held the writs of certiorari in 2 cases involving the law were improvidently granted and vacated stays the court granted earlier this year. So they basically punted it back to the lower courts. Now, again, the issue at stake is not if the life of the mom is in trouble, because already Idaho's Defense of Life Act protects the life of the mother and allows that to happen. But the Justice Department argued that the state's law does not go far enough to allow abortions in more medical emergency circumstances. So I think an example to that is somebody says, look, she's having preeclampsia or eclampsia, or she's having renal failure or blood pressure issues. She could stroke. We need to save the life of the mother and abort the fetus and remove the fetus. That is where it's up in the air. And so they don't have clear definitions of what does it mean for the life of the mother. Is the Defense of Life Act so concrete that it only includes if the mom is bleeding out? And so the mom is bleeding profusely, we need to cauterize, we need to remove the baby and whatever. Or is it more loose and more generalized where, well, mom has cancer and she has aggressive cancer, needs aggressive cancer treatments now. She can't wait another 7 months. So the life of the mom is at stake. We need to end the pregnancy. This is, I guess, what is being debated. And I have said this from the beginning. Let's just keep law and government out. That if we could put this back between the patient and their doctor and leave every politician and taxpayer out of it, it's a medical procedure. It's between the, I think we would limit a lot of the drama. I know pro-life advocates are concerned that abortions will be done under the guise of saving the mom's life when the mom is healthy and the fetus could have been a live, viable baby. On the other end, pro-choice or Roe v. Wade advocates are concerned that if a mom does need to abort to save her life, there's going to be so many rules and regulations, or doctors are going to be so scared of doing anything that people are going to end up dying. So, this is not a very easy discussion to have because it's heartbreaking. It is heartbreaking to see a live fetus that, and knowing embryology and seeing these babies develop and seeing their eyes and their little fingers, knowing that life is being ended in an abortion, it's heartbreaking. It's also heartbreaking to see a mom have to make that decision, to see unwanted pregnancies, to see so many unwanted pregnancies, which I think really is the root we need to also address. Why do we have about 1 million unwanted pregnancies? This wouldn't be an issue. We wouldn't be having all these debates and this back and forth in the courts if we were only talking about 5 or 10, or we're talking about 1 million. Despite all the tax dollars going to Obamacare and free birth control and condoms and prenatal counseling and despite all that, we are still having huge cases and numbers of unwanted pregnancies. I feel bad for the moms. It's heartbreaking. People always ask about, how do these women recuperate mentally after aborting a fetus or a child? Well, there was a study that came out saying most moms are fine. They're good. They can handle it. They're fine. What I've noticed in my practice is some feel they made the right decision for them, but where a lot of the regret may come is when they have the children they keep. And I've had moms come in because, when you interview them and you get their medical history, you always ask how many pregnancies, how many miscarriages, how many abortions. And many will say they're feeling it now, 5 years later, 10 years later. And once they see their live baby, some of them are not, they didn't receive the support they needed to when they had the previous abortion. And so one thing I urge is keep the government out of it. Get it between the patient and their doctor. You don't have to involve Walgreens and pharmacies. I know Newsom went after Walgreens for some pharmacists not wanting to provide the medication. You don't have to involve other people if they find it against their ethics, or they don't want to take part in the ending of a life. This could be a doctor can dispense the medications themselves. We could keep, and the taxpayers, if a taxpayer doesn't want to pay for these and feel like they're supporting that, they don't have to. Get it away from the public, and that keep it between a person and their doctor. That, I think, and the family and their doctor. I think that'll simplify things. But also, hopefully, that doctor will not only provide proper education, but support if the abortion does happen. Is that patient going to have support 3 months from now, 6 months from now, 5 years from now? A lot of times these abortions are one and done. Who is helping the patient if they have regret, if they feel guilty? And I'm telling you, many women do. It's not everybody. But unfortunately, that's another piece to it. We had talked about how with postpartum depression, a lot of factors go into postpartum depression, lack of sleep, hormones. But I had some patients with postpartum depression because they were starting to bring back some of their prior medical procedures, including abortions. So what's happening right now, because the DOJ sued the state of Idaho, saying the Federal Emergency Medical Treatment and Labor Act requires healthcare providers to give stabilizing treatment, including abortions, for patients when needed to treat an emergency medical condition. A person's life being in jeopardy should be covered under that law. But if it's not specified, they're going to keep going back to the courts. 1-877 Doc Daliah.
Considered by most, optimized curcumin is one of the few bioavailable and highly absorbable curcumin products on the market. Hi, I'm Dr. Mitch. Since most chronic diseases have inflammation, our optimized curcumin seems to be a perfect addition to any nutritional program. It makes sense to me that preventing or reducing inflammation is a key component to our overall health. The Mayo Clinic found that curcumin can decrease swelling and inflammation, has antioxidant properties, and research suggests that curcumin can prevent cancer, or at least slow the spread of cancer, and in many instances make chemotherapy more effective. It protects our healthy cells even from radiation. TotalWellness.com, where we help you to look good, feel good, and enjoy total wellness.
Self-reliance. It's not a phrase we hear much in our culture these days. It might conjure up images of pioneers, the West, rifles, strapping men, and strong women. But what does it mean for us in today's world? The New American Magazine has just released its latest collector's edition, Self-Reliance, Foundation of Freedom. In it, the New American authors outline the necessity of self-reliance for a free people, tips for self-reliant living, and the importance of not giving up hope. This unique edition includes articles on the self-sufficiency of the founders, preparing for a worst-case scenario, firearms, financial self-reliance, the importance of community, and many other topics by expert writers. Now, for a limited time, the New American is offering a bundle of 3 collector's editions, Self-Reliance, The Great Reset, and Trump World, for just $19.95. Available at shopjbs.org. Visit shopjbs.org today.
All right, we are back on the Dr. Daliah Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. So, a lot of Supreme Court decisions. They usually come at the end of the month. This way, especially the most controversial, which is going to involve the Trump immunity. That's going to be, Supreme Court likes to basically throw the grenade with a smoke screen and then get the hell out of Dodge. while everybody's starting to, argue and debate their ruling. But so I'm expecting some big ones coming down the pike tomorrow. But today we have learned that the U.S. Supreme Court blocks the EPA's Good Neighbor Air Pollution Plan. Now, this is interesting. I used to work for the EPA. I am a fan of the Environmental Protection Agency in terms of I love our environment. I love our globe. We do have to ensure and teach and educate companies about ways and offer solutions such that they could still do their job, which is vital for our infrastructure and economy, but while at the same time protecting the environment. I think it's pretty cool until they overstep. And that is what was brought to the court recently. So the Supreme Court blocked an EPA regulation aimed at reducing ozone emissions that may worsen air pollution in neighboring states. Now, a 5-4 decision was granted requests by Ohio, Indiana, and West Virginia, as well as U.S. Steel Corp, pipeline operator Kinder Morgan, and industry groups to halt the EPA's, quote, Good Neighbor Plan, restricting ozone pollution from upwind states. And they are contesting the rule's legality in a lower court. So the EPA issued a rule in March 2023 intending to target gases that form ozone, a component of smog, from power plants and other industrial sources in 23 upwind states whose plans did not satisfy the Good Neighbor provision of the Clean Air Act anti-pollution law. So this required steps to reduce pollution. Now, you could think on that outset, well, that would sound wonderful. But there's apparently when we do make these rules, there has to be science, there has to be evidence, and we have to make sure we're not worsening the environment. And we also have to make sure it's not causing an undue burden on a company such that they won't be able to provide what America needs for their infrastructure. So this is why I have such an issue with electric vehicles. Electric vehicles are no friend to the environment. They might, from a fossil fuel standpoint, be a huge win and help for that. But in terms of their weight, in terms of their tires, in terms of their lithium batteries, in terms of their cost, in terms of the expenditure on the electrical grid and their heat production, that, and not to mention the amount of water. We heard about 10,000 gallons of water may be necessary to extinguish an electric car fire. If somebody's going to be making a random rule for the environment, it needs to be pretty obvious. But if there's going to be unintended consequences, then maybe we halt and we rethink this. So the challenge followed a major 2022 ruling powered by the Supreme Court. This is being reported. Let me give credit where credit is due. This is Reuters. All right. So they say the challenge followed a major 2022 ruling powered by the Supreme Court's conservative majority, limiting the authority that the EPA had to reduce coal and gas-fired power plant carbon emissions. Now, the Good Neighbor rule was challenged by Ohio, Indiana, and West Virginia, as well as pipeline operators, U.S. Steel, etc., because they say that the EPA violated a federal law aimed at ensuring agency actions are reasonable. Now, the D.C. Circuit refused to block the rule, so it ended up going to the Supreme Court. Opponents said the rule would impose unreasonable costs and destabilize power grids. The Justice Department backed the EPA, of course, urging the Supreme Court to consider the harms to public health that would result from blocking it. So, again, I am no environmental expert. My work at the EPA involved and ivermectin, anti-parasite medications, how it affected our food chain, food supply. But one thing that I am noticing is we are taking a lot of advantage of our electrical grid. And I think we are not doing it cautiously and smartly. When I see power outages, when I see storms, and when I, just plug in, electrical appliances, electrical cars, electrical this. Our grids are not stable enough for that. They're also vulnerable to hacking. And we are making a nation very vulnerable. And environmentalists are even saying, guys, we might need to rethink this. If you're putting up chargers across the United States, including rural America, has anybody talked about that carbon footprint? And I'm not anti-electric vehicles. I'm eventually going to get one. I can't afford one now, but eventually I'm going to get one. I think it's very cool, and I would love to use less gas. But this is the problem we have. The government makes these random rules. And when people speak out going, now, actually, that we could have a problem with that. We get hushed. We get silenced. Look at what happened with the COVID vaccines. Look at what happened with the COVID masks. How many environmental losses did we have as a result of what we did with COVID? You cannot walk into the restaurant or the store has to have a minimum number of people, so you need to sit in your car. It's 100 degrees outside. Then idle in your car with the air on. Isn't it better to shut the car off and go inside for the environment? Everybody needs to wear masks. These are paper product masks. I thought we were saving trees. Why are these masks ending up on coral reefs? Why are birds getting tangled up in these mask ear loops? Okay, doesn't that hurt the environment? After any customer comes in, you need to spray with antiseptic, and the Environmental Working Agency, and I even believe the EPA, even found that some of these aerosols hurt the ozone layer. And then I thought we're anti-plastic for the environment. Plastic had to go up everywhere. Plastic barriers, plastic guards, everything was plastic. And then whatever happened to recycling? I thought recycling helped the environment. We went from a recycled menu to everything has to be disposable. Well, this is my issue. We're either protecting the environment or we're not. But we don't play it based on what politics and who the president is. And okay, it should be a very evidence-based science on what to do. And so, if these companies who really know and I get, nobody wants to spend extra money. I get that. And to try to be more clean, it costs money. For me, for COVID and for biohazard, you spend a lot more money to protect the public. That's just a given. And trust me, these companies can make it on the back end, as they have been doing, because prices are up and ridiculously exorbitantly high for things. But it can't just be a random rule. And for there to be these rules that are not going through Congress, that an agency is making, when you have industry leaders going, can we rethink this? Because you see the problems it's going to have. There has to be some checks and balances. And trust me, I love our environment. I want us to protect the air. I don't want us to be breathing in pollution. And I get that the more we exist, the more population we have, the more we build. Yes, it could really affect. I mean, we're building in the desert. I live in Southern Nevada. We've been building homes in the desert now for decades, and there's more dust. As dust and stuff is being radon, that's just what happens when you go into nature to build. But, there's got to be science-based evidence behind recommendations. 1-877 Dr. Daliah.
Did you know that healthy arteries make a gas? Yes, actually 3 known gases. Hi, I'm Dr. Mitch, and nitric oxide is a gas that's readily made all day long to keep our arteries open by relaxing the blood vessel walls. By doing this, our circulation is increased, bringing blood, oxygen, and nutrients to every part of your body. Both age and poor diet can lead to a loss of this precious gas, and in turn, blood pressure can go up, energy can go down, and you can get tingling in your hands and feet. Well, our product, Ultimate Nitric Oxide, can easily help fix this lack of nitric oxide. Go to TotalWellness.com That's totalwellness.com, where we are helping you to look good, feel good, and enjoy total wellness.